It's really about fulfilling our mission. I feel as though I'm the steward of the organization during the period of time that I'm in my role. So for me, it's making certain that we're meeting the health needs of the community. And I know that's also a very broad comment, but it encompasses everything from making certain that we have high-quality physicians participating at the hospital, providing care to the community, making sure we provide the physicians and our staff with the best in technology tools to achieve those goals, and last but certainly not least, always looking to say, can we expand the services in the local community? Because we are a community-based facility here in the Hobart community, servicing not only Hobart, but also the Maryville community, Crown Point, Portage, Valparaiso, Lake Station, and Gary. And I feel we're in a unique location because we're sitting right on that border to service large communities in not only Lake, but also Porter County, Indiana. We provide great care to our patients, that the staff is passionate about the care they provide. There are a number of service lines that St. Mary really does an outstanding job with, and it's pretty broad. So we have a great cardiac program here. We're an accredited chest pain center. We're a primary stroke center. We have a great orthopedic service line, so we're not only accredited by the Joint Commission for our hip and knee replacement. For the second consecutive year, we've been recognized by Anthem Blue Cross Blue Shield for the quality of care that we provide. But we also have great obstetrical services here at St. Mary, a very busy OB department. Our cancer program and our women's health are also other areas we're known for. In our mammography area, we provide a great service because we provide same-day appointments, we take walk-in scheduling, and there are days when, if there's a positive finding, we're able to acquire the biopsy and in some cases provide the results that very same day to the patient. To provide the highest quality care in the most cost-efficient manner. But in addition, our mission is also about making certain we preserve the integrity and dignity of the individual, that we're worried about the well-being to the community and servicing, and as well as servicing the poor and disadvantaged. I think from a quality perspective and cost effectiveness, it means every day, every time with every patient, making sure they receive the highest quality care, and then when they're ready for discharge, that we place them in the appropriate location. So we're really building what is very unique to St. Mary is a quality care navigator team, where these individuals are assigned to a patient based on their diagnoses or their clinical condition. Post-discharge, they're calling the patients. We're making certain they have their medications at home, that they understand where their follow-up physician appointments are, and if they're not able to afford even some of their medication, we're becoming very resourceful in working with local pharmacies as well as free programs in the community to get the patients what they need to keep them safe in their homes at discharge. We've been involved with the YMCAs, not only here in Hobart, but also in Portage. In Hobart, for example, we held a Healthy Kids Day where we are talking about healthy eating and diabetes. And it's so interesting to see at such a young age the students able to absorb and really put into effect in their own home environment to be able to take home to their parents and talk about what it means to eat healthy. Here in Hobart, at one of the elementary schools, we also created a teaching garden in affiliation with the American Heart Association, and that was all about, from the very start, planting a garden at the school to see the kids who maybe never saw even some fruits and vegetables that they had the opportunity to experience, and now the school system would like to expand that program from school to school. We also developed a walking path in conjunction with the Portage Y, and now have our podiatrist there every week and a walking club in the community. In the Valparaiso community, we'll also be doing a teaching garden, again at the elementary school level. We saw how well received it was right here in our own Hobart community, and are really anxious to expand that base of knowledge to the students. We do a large number of free screenings in the community, and they're mostly focused on diabetes, heart disease, peripheral artery disease. We participate in mentor programs at the Portage High School, where our leadership is affiliated with a student from the time they're in middle school to the time they finish high school and beyond, to really help mentor them on the right path and a successful career for them. We recognize that as a hospital, this isn't just a structure of four walls, but it is so much about, do we understand what the needs are of the community, and how are we engaging with other community leaders as well as residents of the community to really meet those needs in really fruitful ways day to day. Improving the hospital means everything from capital planning. So our next large-scale project will be actually an entire new surgery department for the hospital at the hospital based here, expanding our intensive care unit because those really are high level of severity of illness patients. It also means providing our physicians the technology they need, but it means enhancing our programs. We're growing our cardiovascular service line, so we want to bring heart valve excellence here to St. Mary Medical Center, so patients would no longer need to travel into the city for their care, that we can provide that high quality care right here at the hospital. But it's about enhancing the education for our own staff and making them feel as though they're part of our St. Mary family and want to stay here with us. I always refer to our employees our best group of marketers, because if they're satisfied here as employees and they know they would bring their family members here for care, we know we're doing a great job, because we've really engaged the people who take care of the patients, our staff, every day here at St. Mary.